So our first speaker of the evening is Dr. Norm Campbell. Dr. Campbell is a general internist, a professor, and a member of the O'Brien Institute and Libin Cardiovascular Institute. He's currently an executive member on the World Hypertension League, the World Health Organization Expert Advisory Panel on Nutrition, and the Technical Advisory Group on Cardiovascular Disease Prevention through Dietary Salt Reduction. He was also very busy with Media Week just this last week. You may have seen him on the news. And he was commenting on changes to school nutrition policy in New Brunswick, where they announced that they would alter the foods that they would be serving in the public schools, including banning flavored milk and juices in the public schools. So without further ado, I'll call Dr. Campbell forward, and he's going to speak today about a paradigm shift from food as a source of health and wellness to now being the leading risk for death and disability in Canada. Please, Norm.
Thanks so much, Raine. This is my first visit to the downtown campus, and it's really very nice. I think we should move the Libin Institute down here. I'm going to talk to you about our current thoughts about food, because many people in the public, but also in the healthcare professions, think of food mainly as a source of health. We all think of food as a source of enjoyment, especially some of the snacks we had out there. But a paradigm shift is occurring where we're having a greater understanding that the food we eat is one of the leading risks to our health, our longevity, and our well-being. And so this slide sort of shows that transition and that I'm going to talk about. So this slide here is from something called the Global Burden of Disease Study. It's funded by the Gates Institute. It's supported by the World Health Organization. And they look at the leading risks for people dying around the world and the leading causes of that death. Now, I do two things in my life. One is high blood pressure, and that is the leading risk for death in the world. But it is right next to unhealthy diets, which is my other major interest. And they're both estimated to kill about 10 million people in 2016. I don't know, that's a lot of people. If you look at the major catastrophes that this world has faced in history, those are more deaths, and most of those catastrophes have occurred over a series of years. About 1 in 5 deaths attributed to unhealthy eating. Now, if we come to Canada, this is Canadian data from 2016, which is the most recent data from the Global Burden of Disease Study. We will now see that dietary risks are at the very top. The leading risk for death in Canada, estimated to have killed 50,000 people in 2016, or be the risks leading to that death. Last I heard, that was about the size of red deer. That not a good thing. Why would the Libin Institute be interested in that? Well, you can see the CVD in the middle color. Those are the heart attacks and strokes. And so if you also look further down at other risks, you'll see that the risk for cardiovascular disease from diet is greater than any of the other risks. Apart from cardiovascular disease, the unhealthy diets are contributing to cancer, and gastric cancer in particular, diabetes, and metabolic diseases. Now, this next slide is again from the Global Burden of Disease Study, but it's not looking at people who are dead. They're looking at people that are disabled. And it was estimated that about 800,000 years of disability occurred in 2016 as a result of unhealthy eating. It was superseded by the great evil tobacco, but you can see that these are competing risks to your longevity. Now, the Global Burden of Disease Study also breaks down the diet as to what are those risks that are being talked about, and this is the Canadian data. It's fairly similar to other countries, although the risks will jockey for positions. But what we have are diets that are processed, and that processing has led to a mixture of things that we're eating in vast excess and things that we're not eating enough of. The excesses include sodium, saturated fats, and simple sugars or simple carbohydrates. But at the same time, we lack fresh fruits and vegetables, nuts and seeds, low-fat dairy products, some fish and poultry, it's important. And so sodium is one of the interests in my life, and you'll see it's the leading additive that's contributing to risk, estimated to have killed about 10,000 Canadians, or just under 10,000 Canadians in 2016. I put the little red arrows there so that you can see trans fats, and then sugar-sweetened beverages at the bottom. Now, sugar-sweetened beverages is getting a lot of traction, but you'll see it's at the bottom. I think it's important that we deal with it. It's not nice that something's killing a few hundred Canadians, but there's many other things that are killing many more. Now, this is one of my favorite slides, and I don't know if people can see it that well, but it's looking at changes in blood pressure with age. And what you can see is a whole series of lines at the top where the blood pressure increases linearly as the population ages. You can see some lines at the bottom where there's no change with age. And so who are these different populations? Canada and industrial countries like Canada are all in that top sector. There's a linear increase with blood pressure with age. Now, who is it that's in the bottom? Well, those are hunter-gatherer populations. They're eating unprocessed foods, they're physically active, and they're lean. And they don't develop hypertension, they don't develop diabetes, they don't develop high cholesterol, and they tend not to develop cardiovascular disease. Now, this talk is not that we want to become hunter-gatherers again and get eaten by tigers, bears, and things like that and die young. But it is to let you know that hypertension, diabetes, and these things are things that we have created with our societies. They are not a part of normal human aging. They are things that we have done, and they're things that we can reverse. Now, it's also illustrative of personal choice. One can see that the hunter-gatherers didn't have a choice to eat unhealthy processed foods or to be inactive. Or to allow themselves to gain weight. If these people, however, migrated to an industrialized society, they would become hypertensive, dyslipidemic, have cardiovascular disease, cancer, and the other disease of our society. So the switch from one society to the other society, it's not that they chose to be healthy in one and chose to be unhealthy in the other. It's what happens to all of us when we're put in those environments. So again, I did disclose that one of my interests was hypertension. So this is looking at why hypertension occurs in the first place. And when they look at it, about a third of hypertension is caused by people eating too much salt in the diet. About a fifth is eating too little potassium. When I say potassium, you can hear fruits and vegetables because that's our main source of potassium in the diet. And about a third is being overweight. And so that explains about 81% of hypertension in Canada. Now, we look at the obesity epidemic in Canada and the United States, it's virtually 100% explained by eating too many calories. Before we had the epidemic, Canadians were relatively sedentary. After the epidemic, we were relatively sedentary. The main change that occurred was we started eating more calories. But what that says is 81% of hypertension is largely on a nutritional basis. We have 6 million Canadians with hypertension because they're eating unhealthy food. It's not a good thing. Now, I'm going to ask you a question. This is, I think, the only question you have to answer in the talk. Is, do you eat a healthy diet? Could we have someone show hands? Okay. Yeah, good. There's too many dietitians in here for this to work well. Who doesn't eat a healthy diet? Okay. So This question is a fundamental question as to why we can't get people to eat healthier in this country. Statistics Canada finds that very few Canadians eat a healthy diet. Even if you look at sodium, potassium, or different nutrients, it's small in the percentages, like 1, 2, 3%. Now, they also ask Canadians the question, do Canadians eat healthy? And we all understand that other Canadians don't eat healthy. And so, you know, if I had asked the question, do the other people in this room eat healthy, you guys would have all said no. When these surveys ask the individuals, do you eat healthy? We go like this, yes, we do, it's everyone else. And it's very difficult to solve a problem in an individual if they don't recognize that they have a problem. And that's something fundamental that we have to address. The vast majority of us, including myself, indicate we're trying to improve our diets. But if you're regularly eating anything more than minimally processed food, such as chopped up fruit and vegetables, it's very unlikely that you're eating a healthy diet. Oh, I lied. There's another question, but you don't need to answer it. Why is it that Canadians think they eat healthy but don't? And I'm going to answer this question for you unless someone wants to jump up and take my spot. Okay. We've had just decades of extensive social marketing campaigns that have normalized unhealthy eating patterns. Every time you turn on the TV and you're seeing a food ad, they're typically having a blast, they're eating unhealthy foods, and it's really normalized what we think about foods. People will think going to a Burger King once a day is healthy. It's a healthy eating pattern, or that pizza's okay because it has vegetables on it. Surveys indicate the widespread inability to interpret our nutrition facts panels, even in people who claim they can read the label. Now, one of the nasty things I did in my career was I surveyed 200 people who had just undergone diabetes education. They were walking out of the education room and they had been trained how to read the nutrition facts panel, and I had a student give them a box of macaroni and say, how much of this macaroni can you eat and stay within your sodium limit for the day? Out of 200, 0 got it right. It's a little tough. There's some uncertainty about the accuracy of the nutrition facts panel data as well. This was back in the old days when the accuracy of the label was actually examined. And when this data was analyzed, it was almost 1 in 5 packages were inaccurate for sodium. Now you think, okay, well, they just can't measure sodium very accurately. Every one was an underestimate of the sodium in the package. Now the government had told industry that they were going to monitor trans fat. The trans fat data was very accurate. Front of package labels based on health claims of single nutrients can and do mislead people about whether they're healthy or not. This product's high in fiber. Well, they're not telling you that it's also high in saturated fats and sugar and sodium. But someone may think from that label they're picking something that's healthy. In fact, there's over 30 front of package labels that may relate to health that could mislead someone about whether the package is healthy or not. Restaurant foods, and we have Mary LeBay in here who's surveyed restaurant foods. Whether they're fast, slow, cheap, or expensive, are largely unhealthy, and in most situations in Canada they're not labeled. There's no current label that currently indicates relevant excesses, deficiencies, and indicates the health issue. And so someone like me, this is not going to actually occur, but it's a wish, a dream. This product is high in sodium. Diets high in sodium cause hypertension associated with gastric cancer and other health risks. Eat it if you want. That's what I'd like to see. So if you're actually eating a variety of fresh or fresh frozen, canned, unprocessed fruits and vegetables, nuts, seeds, legumes with some unprocessed, fresh or fresh frozen, low-fat meats, poultry, fish, then you're likely to be eating a healthy diet. Now, the other issue is, anyone ever heard of a food controversy? Controversy about what people are supposed to eat? And so this is actually a business model. This isn't accidental at all, and this is a business model that was created by the tobacco industry, or perhaps even other industries before them. The food industry is one of the largest in the world. It's estimated to have over $4 trillion of commerce a year. A lot of the research in nutrition is funded by the food industry. A lot of it's of very low quality and could be misleading. We also have, as in every area of science, there's people who disagree. Scientists in particular like disagreeing. I call them dissidents. And I think that's very healthy, except some of them are paid to be dissidents, and the worst of them don't disclose it. Now, it's not just that they disagree, but this huge social marketing campaign of the food industry brings every dissenting scientist view to you. And this creates a lot of confusion, and it's designed to prevent regulatory or policy changes that might affect the industry. And so the current term for that is fake news. Now, I started the talk by showing you the global issue. The whole globe is dealing with nutritional change and the need to produce healthier processed foods. And some countries, in particular the UK industry, is striving to do so. As other countries are trying to import products, they'll be going to the countries that are producing the types of products that they want. And now I happen to be in Cuba, and someone gave me a chocolate bar. I'm sorry I ate some of it. But on the front of it, there was these warning labels: high in fat, high in sodium, high in sugar, high in calories. And I looked at the Cuban who was beside me and said, wow, I didn't know you had this. It was imported from Chile. Okay. Top priorities. And so I had the pleasure for about maybe 15 years of chairing a coalition of national health and scientific organizations dedicated to preventing and controlling hypertension in Canada. And for maybe the last 6-7 years, it's highly focused on the prevention of hypertension through healthy public nutrition policies. And so this group produced a whole series of consensus statements, which doctors, nurses, pharmacists, all sorts of scientists have supported. Some of the names of the organizations there, including the Heart and Stroke Foundation. What they've been asking for is setting targets and timelines for the amount of sodium, saturated fats, and free sugars added to processed foods, including restaurant foods, with government monitoring and oversight. Implementing a healthy food procurement policy. What the heck does that mean? It means that they are buying and providing healthy food with public funds. And I think we'll hear more from Hasan on this. But essentially, the government's telling you to eat healthy, but they may not be buying and providing healthy foods in prisons to the military, in their own facilities to schools, et cetera. And so this is a policy we've been advocating. Restricting food establishments around schools and places that children gather and play. Defining healthy and unhealthy foods. And for the longest time, this was defined by the food industry. And by the way, they defined Fruit Loops as healthy. Implementing clear and transparent conflict of interest guidelines to ensure healthy public policies reflect public interest as opposed to commercial interest. And I think we'll again hear from Hasan some of the evolution in that regard. And I think we can be very proud the new food guide was created in a conflict of interest-free environment. Mandate commercial entities to disclose financial transparencies with healthcare professionals, scientists, and non-governmental organizations. And this is because the worst offenders are people who are not telling that they're getting paid. They're coming in and telling you they're giving you unbiased advice. But we know over history, when some of these people have been disclosed in court actions and others, that they've been paid very large sums of money for undermining public health. Taxing foods that have added sodium, saturated fats, trans fats, and free sugars. And this is in part to recuperate the healthcare costs that they're actually causing. Reducing the cost and increasing the availability of healthy foods because they keep you healthy, productive, and out of the healthcare system. Is the public supportive? I don't know if all you are. I'm sensing the dietitians here for sure are. But when they poll Canadians, the vast majority of Canadians want these types of policy changes. And in fact, if you add up the numbers, it's about twice as many Canadians support these policies as they do any political party. So we need to start a food party at a healthy food place, by the way. So why isn't something being done? Well, I think I'm very happy that finally something is being done, and we're going to hear proposed policies from Health Canada that need strong support from the health and scientific sector as well as the public sector if we're to see them, because there's very strong commercial interests trying to prevent them from occurring. We have Prime Minister Trudeau's letter to the Minister of Health, deal with sodium trans fats, marketing to children, and we'll hear about those things. We have one of Canada's true heroes, Nancy Raine here, who sponsored the bill on restricting marketing of unhealthy foods to kids, and she'll be talking about that. Minister of Agriculture in collaboration with the Ministry of Health to develop an overarching food strategy. And so I'm going to close now with 30 seconds left to go or so. Our processed food diets have led to dietary risk being the leading risk for death in Canada, and very close to that globally. The death and disability caused by unhealthy diets are preventable. Healthcare professionals, scientists, the Canadian public are supportive of major policy changes to create healthy eating environments. Health Canada is proposing new major policy changes to make it easier. Strong support is needed from all of us and the public outside of this setting to make sure that these types of policies go through. And I did lie. One last slide. And so this smiling face that we all see brings up NAFTA. And one of the things in the negotiations of NAFTA is to prevent Canada from putting our warning labels on our food products. And so it's again something that we need to be talking to our parliamentarians, that they need to take our health into consideration. The other thing about NAFTA, which doesn't relate to the smiling face, is that when NAFTA, the first NAFTA agreement came in, there was a massive increase in importation of unhealthy foods from United States into Canada. And it's again something when we're looking at these free trade agreements, not picking on the United States or Mexico, but all of them, we need to be certain that they're not just bringing a whole pile of things that may create an unhealthy environment in our country. Thank you so much.
Thank you very much, Dr. Campbell, for starting us off and showing us the shift that's taken place in our food environment. We're also very pleased to be able to have representation and the perspective from Health Canada here this evening. And so we have Dr. Hasan Hutchinson and Dr. William Yan, who will present for us. Dr. Hutchinson is the Director General of the Office of Nutrition Policy and Promotion at Health Canada, and the co-chair of Canada's Dietary Reference Intake Steering Committee and of the Federal Provincial Territorial Group on Nutrition. He serves on a number of nutrition-related committees at the World Health Organization and the World Cancer Research Fund International. Dr. William Yan is the Director of the Bureau of Nutrition Sciences in the Food Directorate at Health Canada. And since 2010, he has provided leadership in the Bureau's work on developing nutritional standards and regulations, as well as the pre-market assessment of foods, fibers, health claims, and infant formulas. He's currently working on a number of healthy eating strategy projects, such as sodium reduction and nutrition labeling initiatives. So we're very pleased to have them present today on healthy eating strategies and planned policies.
Well, lovely to be here, and thank you, Norm, for telling me what I'm going to talk about tonight. And I wasn't quite sure that that was what I was going to talk about, but I'll try and fit it in now. I guess that's the option. So it is really an exciting time, as Norm has really introduced us to healthy eating is dreadfully important. It's dreadfully important for the health of Canadians. It's dreadfully important for our economy and for our provinces and territories to try and keep their budgets online. So it's something that we really have to concentrate on. And fortunately, because of the mandate letter from the Prime Minister, we at least at Health Canada have been given a bit of a mandate ourselves to do some real action on that. So the first one just is oh, there it is down there. I knew I could see it somewhere, but I didn't know where he was looking at. So this is when the mandate letter came through from the Prime Minister to the Minister. It really gave us an opportunity to think differently about how we deliver nutrition programs, policies, and standards out of the Government of Canada. And instead of sort of responding to the individual requests to work on marketing to kids or to work on sodium and stuff, well, we took the time to really put it together in what we think is quite an overarching, comprehensive healthy eating strategy. And that's what we've sort of presented here. We sort of have bundled it into a number of different themes there. We're talking about better nutrition information, improved health quality, protecting vulnerable populations, and improving food access and availability. So those are sort of the themes which we will then, as we go forward, imagine we continue those themes. The particular files that we've been focusing on are sort of underneath those little diagrams there. So, of course, revising the food guide, I'll talk a little bit about that in a few minutes. Improving food labels, something that Will's team has been doing a lot on, and they've already done a lot, actually. As you're probably all aware, the nutrition facts table has been updated, been standardized, as well as reworking with respect to the ingredient list, where for instance, they've grouped all sugars together, so you really have an idea of how many sugars are in the food just by looking at the ingredient list. Will's team's done a great job on that, and Will talk a little bit about the front of package labeling. With improving food quality, will come back and talk about reducing sodium in the foods, and this other one about prohibiting industrial trans fats, that's another thing that Will's team has done just a brilliant job on, and as of September 15th, industrial trans fats, partially hydrogenated oils, will be prohibited in Canada to be in your food supply. So that's a major, major step. And once again, that's Will and his team that have really led that for us here. But I'll take the applause. It's kind of nice every once in a while to get it. We're used not to getting applause at times. Protecting vulnerable populations, of course, that we're talking about the marketing to kids, and that's where we've got a nice linkage. Now, Nancy Green-Raine is somewhere out there, I assume. I thought she was around. Oh, there you are, over there. So it's really nice when you can have the Senate sort of taking real strong leadership from a legislative side, and then we in government are as well to complement that with the work that we're doing from a more regulatory perspective and really developing the policies. So it's been a really nice relationship that we've developed there. And the leadership, again, as has been mentioned by Nancy Green-Raine, has been spectacular on this particular one. And then, of course, there is the Nutrition North. I'm just kind of trying to be aware of my time here, because whenever I talk before Will, I tend to use up all my time. But with respect to the health eating strategy, one thing that was also mentioned is that we do have this larger strategy of developing a food policy for Canada. So that's something that we are working with other departments. I think there's a total of 16 different departments and agencies where we're working together to think much larger. So as well as having health, we're talking about food insecurity, we're talking about the environmental concerns, and we're also about making sure that we have a vibrant agricultural sector as well. So it's really something that we hadn't really done much before either, and that's sort of trying to make sure that our policies are a lot more coherent across Canada with respect to food. So that's where we're going. We're trying to really make an impact on the long-term health outcomes, and really what it is to reshape the food environment and to make sure that one can make those healthier choices. But it goes beyond just a consumer choice. It has to go much, much deeper than that. It's really how can you get the structural changes so people that can actually make those choices, that you've got the right type of environment where it just helps to have the access to healthier diets. So, the evidence base, this is all one thing that we have put a lot of effort into is making sure that we're working with the strongest evidence. We developed a very robust process for developing our evidence for all of the work that we've been doing with respect to the healthy eating strategy. We've published on that. We use the strongest evidence. We're very convinced that we really are using the best evidence that is available out there. I'm not going to spend an awful lot of time on this, but of course, when we're working on nutrition, and probably all of us in the room here know that you can really create any particular story basing it from evidence or publications that are out there. There's a lot of variety. So what we've tried to do is to choose the sort of from the top of that pyramid, the high quality meta-analyses and systematic reviews where they sort of take into consideration more the totality of the evidence that's available. And then what we do is look for where there are very strong, convincing relationships between foods and nutrients and health. So we have very, very clear exclusion and inclusion criteria for choosing, looking at those relationships. And that's all from an openness and transparency perspective. That's something that we've published the methodology, we've published our results from that, so it's available out there as well. I'm not going to spend much time on that, but this is just sort of going through a bit of the process we take to step through how we establish which are the strong, convincing relationships that we have between food and with health. I'll just skip through that just because of a time constraint. As well as looking, of course, at the relationship, the evidence that we have between food and nutrients and health, there are other things that we have to take into consideration as we develop our policy and our dietary guidance. And of course, that has to do with the intakes of Canadians, the consumption data. And fortunately, we do have fairly recent consumption data from 2015 out of Statistics Canada, so we know what people are consuming. We also have an idea of the health status of Canada. And then, of course, through a lot of the work that we've been doing in our research, we've figured out is there need for consistency from different levels of government in terms of of what we give in terms of guidance, and where do we need to have more clarity. So we've been working in that direction. So first, I will talk briefly about where we are with respect to the food guide. And I guess the main thing here on this particular diagram is that we're moving completely away from the type of a food guide that we have really all known and perhaps loved, perhaps not loved, a bit of a mixture there. We have had, as I said, what we call an all-in-one tool, basically a 6-pager, which was supposed to be for health professionals and policymakers. It's supposed to be for those folks that have to develop menus in institutions, whether it's in hospitals or correction institutes, or what is sort of taken in, available through healthy school programs. It's supposed to as well be for policymakers, but also for consumers. So you have 3 very different functions from that particular food guide. And I think that I would question whether any of those functions have really worked all that well. So what we've made a decision that we're going to move away from having sort of a one-for-all type of a thing, and what we're developing right now is much more of a suite of different products where we think of the different audiences and what their needs are and develop a food guide component that is for them. So for instance, with respect to dietary guidelines, if we're thinking of for health professionals or for policymakers, well, you need to have a lot more detail. So, you know, the draft dietary guidelines that we've got right now, they're running around 70 pages or so. So that's a different sort of an approach than what we've ever used before. But that allows us to really get into the depth of discussion that health professionals and the policymakers really need to know and use in their everyday practice on that. We're looking at consumer messages, tools, and resources that are really making it easier for consumers to get what the bottom line is in terms of the messages, and to really try and be able to incorporate it into their everyday life, whether they're out in shopping, whether they are at restaurants, whether they're preparing meals, whether they're doing their planning. And we're trying to, because the information environment has changed so much from the last release of the food guide. I mean, in 2007, that was the year that the iPhone came out, you know, so the way we access information has changed drastically. It's almost like it's centuries ago since 2007 from access to information. And so what we're developing right now is a mobile-first web platform where really the main drive in will be through, whether it's your phone, whether it's your laptop, whether it's your computer. The idea is wherever you are, whatever degree of information you want will be, oh yes, 10 minutes. You should be able to do that. We have done a lot of feedback in terms of going forward on the food guide. Most of you have probably participated in both of our consultations. The first one was around 20,000 people about a year and a half ago. We did one last year. About this time, actually, we were out on consultation on the food guide. We put out these draft, you can't really perhaps see what's there, but we went out last summer and talked about a number of different areas, 4 different areas. The first area at the top has to do with sort of the foundation for a healthy diet, and of course lots of fruits and vegetables, and lean meats are in there as well. Water is sort of what you drink. The second sort of batch of things have to do with those things that undermine healthy eating, and those are the processed foods, processed and prepared foods and beverages that are high in sodium, saturated fats, and sugars. The third one is really more about how you do that, and that's the need to really develop a very strong food skills, and what do you have to put into place so that people can develop their food skills as well. And the last sort of group of three at the bottom have to do with really how do you implement that, and that's where it's so important to be aware of health equity issues, determinants of health as you roll out these sets of guidances. What you've got there is the sort of the responses of academics to it, and so the green is agreeing very strongly with what we put forward, and the lighter green is agreeing with what we put forward. So you can see that we had, from academics, had very strong support, and from most Canadians we did as well for that. The set of resources, as I said, will be quite varied, and we've got, of course, the policy, and then we've got whole sets of different things that will be available for consumers. Now, these slides are all be available, because I think I'm going to move on a little bit fast, just because I'm running behind for Will. And then next year, around this time as well, that's where we'll get into really working on the patterns themselves. We are busy doing the modeling, and that with the health eating patterns will be a second policy release that will happen in about a year's time. There will be new materials, of course, for consumers throughout that whole time period. So that's that for the food guide. The restricting marketing of unhealthy foods to kids, as I've already mentioned, this is something that is well underway right now, and there is a session tomorrow, so we'll go more into detail on this tomorrow. The next steps on this, of course, is we hope that we'll get third reading very soon on the bill, and we are working right now on, as I mentioned earlier, on moving forward on the regulatory proposal. So I will pass you over to Will.
Well, good evening, everyone. It's a pleasure to be here. I think it's the first time I've come up to give a talk, and I got up here, and there's a 1-minute sign that's up already. Okay, so I'm going to try to go through the rest of the... Yeah. I was starting to panic when you spent 7 minutes on the first slide. So the first thing I want to talk about is the latest proposal that we're going to change how information is given on the food label. As Hasan mentioned, we did a lot of work already on improving the nutrition facts table and the ingredient list, and all that work was done and finished by the end of 2016. But as Norm mentioned in his talk, if you look at the front of a typical package, it's a very busy place. It's got a lot of colorful images, it's got a lot of claims such as nutrient content claims that tell you this food may be high in fiber or vitamin D or calcium. It might even have some health claim that tell you that this will help you lower your cholesterol or actually can reduce the risk of heart disease. What you don't normally see, though, on the front voluntarily is that company will declare that this is high in sodium, sat fat, or sugar. So one of the ways that we try to complement the information on the NFT and the list of ingredients is we are proposing to add a requirement to declare high levels of sodium, sat fat, and sugar in the food if they exceed a certain threshold, and that is what we call front-of-package labeling. So in February this year, after doing a lot of work, a lot of consultation, and a lot of discussion with experts, we put out a regulatory proposal that was going through the CG1 consultation, and we did something different in this case, where the normal consultation would go into a lot of details in regulatory language around what the regulation is going to look like, so that we look at the location of the symbol, the size, look at the threshold that would trigger the symbol requirement. So that's all in the regulatory package. But recognizing how important the symbol itself is, we decided to actually at the same time did a separate consultation, mostly targeted to consumers. And we looked at 4 potential symbols that were tested. And throughout the 75-day consultation period, we received over 16,000 comments on just the symbols, and then we also received over almost 8,000 set of comments on the rest of the package. So while Hasan and I are here talking to you, my team is back home now going through all those thousands of comments, trying to triage them, look at the rationale behind the comments, and to see whether we need to make any adjustment to our proposal. And hopefully we'll have the final package ready, and that'll be published as final regulations sometime in the fall of this year. So one of the things that we were doing while we were waiting for the comments, we decided we couldn't just sit there and do nothing. So we decided we'll do some further consumer research to complement the ones that we did previously. And this is some really exciting work that was done either through online survey, but also in using a food lab where we use eye tracking and other technology to look at actual behavior in a mock shopping environment to see how those symbols on a packaged food may or may not actually change how consumers look at the food and also how they perceive a food to be, whether it's healthy or not. So again, the team is analyzing all that data now, and we're using that also to inform on our final regulatory package. So next steps, as I said, we're finishing off all the reviews and making any adjustments if necessary, and looking forward to getting these published in Gazette 2 in the fall, and that will be a major, major accomplishment under the mandate letter from the minister. So, hey, not only you get the applause, okay. So you also remember in the slide that Hasan talked about, one of the pillars that under the health eating strategy was improving the quality of the food supply. So in addition to eliminating industrial trans fat, we also want to tackle sodium, as Norm has so nicely put, that sodium and hypertension is a huge health risk factor for Canadians. And sodium reduction is not a new story. We've been working on this for many, many years now. But this mandate letter and the way we are positioning sodium reduction underneath the entire healthy eating strategy is the first time that we're looking at sodium in the bigger context of healthy eating. And I think we're actually going to get more momentum and more positive outcome out of this going forward. One of the major things we did was in 2012, Health Canada published voluntary targets for 94 categories of food. So we set limits on each of these categories, and we gave industry until 2016 to meet all these targets. So in 2016, at early 2017, we went out and we collected over 10,000 labels, and we analyzed the sodium information on these labels for all these 94 categories. And in January this year, we published a report on how industry did in all of these categories. And the report has been published, and you can find that on our website. But this is really the slide that really captures the results. So I used to call this the good, bad, and the ugly. So if you look at the red half, the way we set the target was we actually set different phases of the target. The first phase was about 10% reduction, second phase was 20% reduction, and then the final target was about 30% reduction from the original baseline level. So the red portion are the products that did not even meet the first 10%. The green is the good news. The green ones are 14% that actually met or exceeded the final target, which is really good. The yellow, they met the second phase, which is 20% reduction, and the orange is they met 1/3 or 10% reduction. So clearly, industry did not meet all the targets, but we didn't really expect them to, because sodium reduction is much more challenging than removing trans fat, because as most of you know, sodium actually has a lot of important functions in food safety and also in the property of the food. So there has been reduction, but clearly there's more work that needs to be done. So the next step on sodium is, while we now know what's going on in the food supply, what is really interesting is find out how much sodium is actually Canadian consuming. Back in 2010, we did a analysis to show that with the food supply that was the way it was in 2010, and the way consumers consuming food based on the 2004 CCHS survey, it was estimated that Canadians was consuming about 3,400 milligrams of sodium a day. The target we want to get down to is about 2,300. So, as Hasan mentioned, we now have 2015 consumption data. We now have what the food supply looked like in the end of 2016. So again, the team now is finalizing the analysis of that to see what the number is in 2016. Based on the food supply, we're not expecting it, that we probably would, if I had to bet, I'm not going to bet on 2,300. It will be somewhere between 3,400 and 2,300. And that report should be coming out very, very soon. We're just finalizing some of the details and getting final approval for publishing on our website. So look out for that. We're also going to continue to engage industry because industry actually did work quite hard in trying to reduce sodium. There were some success stories. We are now meeting with different associations and companies to look at both success stories, but also some of the challenges that they faced in the last 5 or 6 years, and see how we can help working together to either revise some of the targets or maybe even change some of the categories so that the food can be captured a little bit more efficiently to look at actual sodium reduction. So we're going to be publishing either new or revised targets for processed foods. But what's really exciting is that we're also, for the first time, going to publish targets for restaurant foods as well. We couldn't do that in 2012 because we just didn't have the time and the resources to do it. But in the new strategy, we're now very close to going out and consulting on the first set of restaurant targets. And I think that will also go a long way in trying to change eating patterns in restaurant in addition to processed foods. And of course, our front-of-package labeling will also help in sodium in 2 ways. It will alert consumers to look for food, to recognize food that are high in sodium by looking for that symbol on the front of the package. But a secondary objective is that we expect there are certain food that's going to be right at the threshold of that trigger for requiring the front-of-pack symbol. So we expect that over the next few years, company will try to reformulate the product. If they're really close to that threshold, all they have to do is reduce the sodium a little bit, and then they won't have to carry the symbol anymore. So there'll be another incentive to lower sodium in those areas that are very close to the threshold. So I actually made it with 1 minute left. So that was a very, very, very quick summary of 2 of the really, really key initiatives that we're working on under the healthy eating strategy. And we're really excited that, again, as Hasan mentioned, and Norm also, that for the first time, we actually have a broad spectrum overarching strategy that allows us to work on things that are complementary to each other. So we know that healthy eating is not a simple challenge, and it's not going to be a simple solution. So we recognize that all these pieces have to work together, and hopefully, as we keep coming back and talking to audience like you, that we can report on some of the things that we're able to do, and more importantly, we can monitor and actually see that these policies are making a positive difference on Canadians' health. Okay, thank you very much for your attention.
So I love visiting New York City, and I think our next speaker Kim Kessler, I'm going to give her some of the responsibility for making New York a great place to visit and for people to live. So Kim Kessler is the Assistant Commissioner for the Bureau of Chronic Disease Prevention and Tobacco Control in the New York City Department of Health, where she facilitates healthy and active living for all New Yorkers. She helped launch the Resnick Program for Food Law and Policy at UCLA School of Law and served as the Food Policy Coordinator for New York City, coordinating several initiatives to improve access to nutritious foods and to combat obesity. Please welcome Kim.
Thank you so much. I am really pleased to be here representing the work of so many current and former New York City Department of Health employees who've been involved with the implementation of our city food policy strategies and these efforts that began more than a decade ago. I'm also pleased to be doing it here in Canada, home to much forward-thinking food policy, including at the local level. And actually, when I was the food policy coordinator for New York City under Mayor Bloomberg, I had the opportunity to learn from some of the early work and leadership that we'd seen in Toronto on municipal food policy, and even visit and see some of the food policy programs in action there. And that's actually one of the themes I'm hoping to highlight tonight, the importance of sharing across jurisdictions and the role that municipalities can play in that. So this is the overview of what I hope to touch on. Just some general background about New York City and the urgency of these issues, the need for action, what we can do in localities and the approach that we take around changing the context. And then I'll highlight a number of interventions tackling certain areas that we've been focused on: the overall diet, reduction of sodium and sugary drinks, and increasing consumption of fruits and vegetables. So beginning with some background and context about our agency and then the city overall. So the New York City Department of Health and Mental Hygiene is quite a unique local public health agency. We're very large. We have over 6,000 employees, though to my dismay, the vast majority of them do not work on chronic disease prevention, but in a whole host of areas from animal control to food and restaurant inspection, as you might imagine. Our mission is to protect and promote the health of all New Yorkers, and all New Yorkers means almost 9 million residents. We are a majority people of color city. About 4 in 10 New Yorkers are foreign born, and about 20% live in poverty. So we're unique as a locality because of these characteristics, and also our department because of its ability to impact such a large population, and because we do have substantial resources and technical ability, including the ability to invest in surveillance and research and evaluation over time, which has been really important for our efforts. So you had a wonderful overview of more current data than this from Dr. Campbell, but this is really just a snapshot of some US-based data on the leading risk factors for death. And it's just looking at what our current reality is, so we can see what an important role diet-related diseases are playing, and diet is playing and leading to those diseases. And it was really this reality that mobilized the department early on in the new century to begin to implement new and innovative approaches to food policy. Recognizing that we were in a new era of epidemics of hypertension, cancer, diabetes, heart disease, and that they were extremely catastrophic if slow-moving. But before talking about some of what those interventions were, I want to really focus on what one of our driving concerns is in New York City, which is health equity, because we know that while not only are we facing this tidal wave of chronic disease, but the disease burden is inequitable. And those disparities are really very clear in New York City. So I'm going to go through a series of maps of New York City. These maps are showing self-reported data for obesity and diabetes, and the sections that are the darkest red for obesity, that's about a third of residents reporting that they're obese, and then 14 to 19% of people reporting that they're diabetic, compared to a citywide rate of about 11%. Looking at diet-related behaviors, we can see fruit and vegetable consumption. The darkest red areas are where you have less New Yorkers eating fruits and vegetables every day. And then that's sugary drink consumption, where the darkest red areas are the prevalence of New Yorkers reporting drinking 1 or more sugary drinks per day. And in the darkest red areas, it's between 35 and 42%. So we would expect these behavior maps to track closely with health outcomes. It's not surprising, because we know that if we do care about health, we have to really care about food. But there's also broader factors at work. And this is an example of just one of those. We know that healthy food has gotten more expensive over time. This is looking at fruit and vegetable costs, and they're outpacing the consumer price index in the US, while sweets and snacks and carbonated drinks are getting comparatively cheaper. And this is just one example of how low-income consumers are disadvantaged when making choices about what to eat. And there's even broader systems at work as well. So these maps show race by neighborhood, poverty, and premature mortality in New York City. You can see that the darker regions of each map above show poverty and premature mortality tracking closely with racially disparate New York City neighborhoods. The Upper East Side is one of our wealthier neighborhoods, and it's a very short subway ride from the South Bronx, which is that circled area in to the north of the map. But the gap in life expectancy is almost 9 years. We know that this isn't biology, and it isn't the product of individual choices. The maps make clear how we are all living within systems and structures that shape our own opportunities for health. We believe that as government, we have an obligation to act with the necessary urgency to change these outcomes. And I think this is particularly important to highlight when we're talking about food policy, because it's an area that's often contentious when government moves to act. And there's a big conversation if food choices are seen as individual choices and personal choices. There's less of a leeway for government to step, but when we can look at these maps and see the broader systems at play, I think it creates more space and recognition about the appropriateness of government action. So what can cities do? I'm going to talk a little bit about our approach. We like to use this slide to show our approach. It's depicting the interaction between individuals and their environment and showing that even if you are an individual who's seeking to make healthy choices, if the environment is working against you, it's going to be really difficult. And so we see it as part of our role to try and flatten that slope while at the same time resourcing individuals with the knowledge that they need to navigate a really complicated and challenging food environment. So that's our approach, and these are our goals. We want to increase the access to and awareness of healthy foods and decrease the availability and overconsumption of unhealthy foods. And it just sounds so easy when you put it like that, but we find it takes a lot of thinking and layering of efforts over time. And this is how we try to identify opportunities for action. As a municipality, we're really looking to see what points of authority we have and where we can invest efforts and resources to have the largest impact. Our tools for our work are essentially policies, programs, education, research, and partnerships. And there's a whole spectrum of points of potential intervention within the food system where we can operate. So we have to think about where we have more authority and control, and that's, for example, areas like procurement, or where we have other types of regulatory infrastructure that we can leverage, such as restaurant inspection. And then there are areas where we have less direct control and authority, where we've tried different types of approaches. And to be effective as a locality, we especially need to consider issues of scaling and sustainability, because we've seen that the layering of approaches over time has been critical. So I'll now turn to highlighting some specific interventions in New York City. So procurement was raised earlier, and I was so glad, because we have really looked at procurement as a way to impact the overall diet. And this has been an incredibly important opportunity in New York City, because we actually serve almost 250 million meals and snacks per year through our city programs and city contracted services. So these are the meals that are often being offered to our more vulnerable populations in our city homeless shelters, our schools, our daycares, our senior centers, our jails, and our public hospitals. In 2008, the city launched a set of nutrition standards for the food served by these agencies. And in general, the standards are working to shift the overall offerings of the city to be healthier by requiring more servings of fruit and vegetables, higher fiber, and then restricting the amount of sodium, added sugar, and unhealthy fats that can be offered. It's also been a great opportunity for us to harness the city's purchasing power in this way, because it does send a significant market signal to companies because of our purchasing power, and can encourage reformulation in that way. And we think it's also critical that we walk our talk and lead by example, particularly as we seek to set out to introduce policies and programs in other areas. We've built on these standards by extending their reach to other sectors of society. We've adapted standards for hospitals and also created adapted standards for community-based organizations and nonprofits as well. So turning to sodium. Sodium reduction has been a key part of the department's approach to chronic disease prevention since about 2008. In the US, adults consume 50% more sodium than recommended, and as has been talked about, the majority of sodium is coming from foods that are processed or restaurant foods. So it's in the food before it's reaching the table. And for most people, as we've also talked about, the reality of how we eat is quite different from the ideal. So it would be virtually unattainable for people to change to eating all unprocessed foods and cooking at home exclusively. And this is why we've seen reformulation as such an important opportunity. We set about in 2009 to launch the National Salt Reduction Initiative, and similar to what was just described that Health Canada did, our federal government was not taking action, and so New York City started this effort with other local partners and organizations across the country. And we set voluntary sodium reduction targets for the food industry, and then invited industry commitments after an iterative process where the industry gave input into those targets. And then we monitored those changes over time. This was also inspired by an effort launched in the UK, which is another important example of how we can learn from this global community around food policy. So the impact showed that what we consider to be a modest but still promising impact. Through the monitoring of sodium in packaged foods, we saw that from 2009 to the beginning of 2015, sodium levels decreased in a sample of top-selling packaged foods by about 7%. We see that as showing that sodium reformulation is achievable during a relatively short period of time. And we're very encouraged that since this time, the FDA, our Food and Drug Administration, has proposed draft short and long-term targets and has recently expressed a commitment to moving on sodium in 2019. Being encouraged by this process, we're now expanding this model to include sugar. So it will now be the National Salt and Sugar Reduction Initiative. We're in the very early stages of this, and we hope to be sharing draft targets for public comment later this summer. But what about restaurants? So restaurants were also part of the National Salt Reduction Initiative, but they made much less progress with a couple of notable exceptions. And New York City has been monitoring the sodium in chain restaurants for some time, and we saw through that surveillance that approximately 10% of restaurant items offered at chain restaurants exceeded the recommended daily limit of 2,300 milligrams per day. And this slide shows an infographic that gives examples of some very high sodium items that are available in New York City. They are far exceeding that daily recommended target of 2,300 milligrams, and these are at well-known chains. This image actually appeared in one of our local tabloids, the New York Daily News, after we announced a new policy that was set to help consumers navigate a salty restaurant environment. We are blessed with a very rich media environment in New York City that definitely plays a role in our food policy conversations. And this, I'm hoping that this is Dr. Campbell's dream come true, because we actually enacted a sodium warning. The sodium warning rule requires chain food service establishments to identify high sodium items, so any item that is over that daily recommended limit of 2,300 milligrams. And they must show that icon next to the item and then post a warning statement at the point of purchase, and the warning's indicated on the slide. And we're happy to see also that Philadelphia has recently moved forward with a similar type of approach. This was implemented in 2016, and we're currently in the process of implementation. But we were not starting from scratch when we went forward with this policy. We were building off many significant prior efforts in New York City in the restaurant environment. Our restaurant-focused efforts began with the trans fat restriction. In 2006, our local Board of Health passed a rule that all city restaurants begin to phase out the use of artificial trans fats. Interestingly, this followed a voluntary initiative aimed at achieving this goal where we had education and technical assistance, but evaluation showed that we had not made much progress, and so a policy of restriction was pursued. Then in 2008, the city required that all chain food service establishments post calorie information on their menus and menu boards, and we were the first city in the United States to do this, and then followed by many localities. The calorie labeling policy was ultimately adopted with some changes at the federal level as part of the Affordable Care Act, Obamacare. And then after very extensive delays, it just recently went into nationwide effect actually last month. So we're thrilled to see that in place. The trans fat regulation was not adopted nationwide, but our Food and Drug Administration did make a determination in 2015 that trans fats would no longer be considered what they call GRAS, meaning generally recognized as safe, and this should virtually eliminate trans fats from our food supply. And this policy actually went into effect today, so we have something to celebrate, and we're very pleased with the city's leadership on this issue. I'm going to turn now to sugary drinks. So we actually see sugary drinks as a really important and unique public health opportunity, in fact, a singular public health opportunity. And this is because they contribute about almost half of the added sugars that Americans consume. They've been a focus for our agency for a long time. Some of the policies that I've discussed already have helped to tackle sugary drinks, including our procurement policies, which eliminate them from city environments, as well as calorie labeling. And we've also adopted regulations in our licensed daycares and day camps that eliminate sugary drinks from those offerings as well. Nonetheless, industry marketing and the ubiquity of these products remain a huge challenge in New York City. We've tried to counteract this with our own messaging on sugary drinks, and these are two examples of our campaigns. One you can see is highlighting how difficult it is to actually balance the calories consumed in sugary drinks, and shows that you have to walk about 3 miles to burn off the calories in one 20-ounce bottle. And the campaign on the right is our most recent one, and this is actually the first to explicitly call out the role of marketing. This campaign says that advertisements make sugary drinks look good, but they don't show the whole picture, and then highlights the health harms of sugary drinks. We've been running media campaigns like these for almost 10 years. They're part of our public education efforts, but we also consider them part of our efforts to denormalize sugary drink consumption. The city's also had some well-known policy attempts to address sugary drinks, including advocating for a sugary drink tax back in 2009 and 2010. We don't actually have the authority legally to pursue a sugary drink tax on our own in New York City. We would need the state to do that, but we ran into political opposition, and that was not enacted at the state level. And there was also the effort, a somewhat notorious effort in 2012, to limit the portion sizes of sugary drinks to 16 ounces. This policy was certainly among our most contentious. This image was part of the industry's opposition campaign. It appeared in many people's mailboxes, but also on distributor trucks all around the city and in many other places. And it says, "Don't let the bureaucrats tell you what size beverage to buy." And so again, this is invoking that individual liberty concept of personal choice around what we consume. And this argument was certainly picked up in the public conversation about the policy. Those in support of the proposal pointed to the huge amount of sugar in large-sized drinks and the way that the industry had actually shaped the environment to increase portion sizes over time. Ultimately, the city was blocked by the courts from implementing this policy. So where have those efforts left us? We've actually seen some progress in New York City on sugary drinks. There's been a 37% decline since we began tracking this in 2007. And this slide is showing some of the different efforts over the time that we've pursued or implemented. And while we can't attribute the decline to any one policy, we're certainly pleased to see that this is moving, on this topic, we're moving in the right direction. Our efforts are, of course, bolstered by the work that's happening at the federal level and other states and localities and researchers and advocates who are making a tremendous difference in raising awareness around these health harms of sugary drinks. And one thing that is notable is that we had our single biggest year-to-year drop between 2012 and 2013, which was the year that the portion cap was introduced. So I think it shows that there's value in trying things. When we're in this space of food policy, it can be difficult to know how to move ahead, but there's certainly value in trying and contributing to the dialogue on these topics as well. So I want to finally move to fruits and vegetables. And I want to highlight one of our programs called Health Bucks because it's a nice example of how a program can grow over time. Health Bucks in New York City are $2 coupons that are redeemable for fruits and vegetables at farmers markets in the city. They're distributed in several ways. One is as an incentive for those who are using their federal food assistance at farmers markets, so SNAP, or formerly known as food stamps. If you spend $5 in food stamps at a farmers market, you will get a $2 voucher redeemable for fruits and vegetables, so it increases purchasing power by about 40%. The other way that they're distributed is mostly to our community partners, to over 450 organizations in New York City to use in their food and nutrition programming. This program has been important to us because it does increase affordability of fruits and vegetables, but it also plays an important role in supporting our regional farmers and in making farmers markets a more viable form of food retail in low-income neighborhoods. Since its inception in 2005, over $5 million have been distributed through this program, but it was not always such a large program. When it started in 2005, it was with less than $10,000, and it was available in just 11 South Bronx farmers markets. It was started out as the idea of one staff person, and then with support from partners in and outside of city government, and grew in the next year, and the idea of linking it as an incentive for using an incentive with our federal food assistance program at farmers markets took hold. It was eventually expanded to be available citywide, and following advocacy from partners across the country, in our most recent National Farm Bill, which is our major food policy legislation in the United States, a new stream of federal grant funding, $100 million over 5 years, was made available to support our healthy food incentives. Health Bucks was one of the programs that helped lay the groundwork for this funding. We were awarded a 4-year grant, and we've been working on expanding the program currently in New York City. And I want to highlight just one program that we are embarking on with that federal funding. We've looked to new settings to expand the incentive model, including our new Pharmacy to Farm program. Through this program, when a low-income patient picks up their hypertension medication at a pharmacy, they may be eligible to receive a prescription for $30 worth of health bucks. So they can take the prescription to the farmer's market, then they will get the vouchers, which they can use over the course of the next month while they're waiting to refill their next prescription. Our hope is that this will increase fruit and vegetable consumption and potentially encourage medication adherence as well. I wanted to close with highlighting this particular program because I've been talking about the work that we do that's focused really in the community setting and trying to make healthy behaviors easier, whether in ways that are invisible to the public, like the trans fat restrictions, or by giving people more information. But in the larger context of the United States health policy, we know that many more resources are going towards treatment and the clinical setting rather than the policy and the community types of interventions that I've really been talking about. So we see right now as a critical time to bring public health and clinical systems together and to make a major effort to catalyze our work and to better align the work in these two settings to shift resources towards prevention, hopefully through models like these. So I'll just close with a few thoughts. I think I'd just say that we recognize that the food system is intensely complicated and it's governed by many factors, most of which are outside of a locality's control. Nonetheless, there's a lot that cities can do. They can really make a difference. Cities can work to change the context and they can layer those changes over time. And that can contribute to overall culture change, which is what I really think that we need to change our food policies. Cities can institute changes relatively quickly, and this is important because we can test and evaluate and then truly inform federal policy as well as sharing our learnings across jurisdictions. And we have an important obligation to focus on equity as well. We're closer to our immediate residents and we have more knowledge about the communities that we serve. I want to say possibly the most important reason that cities should take action is just that inaction is not an option. And we really need to recognize the urgency of the situation and press forward on these issues at all levels of government. Thank you.
Now, as mentioned at the beginning, we also have expertise in Alberta in nutrition, and so we're very pleased that Dr. Kim Raine has come down from Edmonton. Dr. Raine is a professor and acting vice dean in the School of Public Health at the University of Alberta. She is also the scientific director of the Center for Health and Nutrition at the U of A. She's a registered dietitian, former president of the Alberta Public Health Association, and a fellow of the Canadian Academy of Health Sciences. Her research focuses on exploring population interventions to address healthy eating. Please, Kim.
Thanks. So we were shocked to hear the stats about how much of a problem that diet is. We were inspired to hear about some of the things that are happening federally to make healthier choices easier, and totally amazed by the progress that's happening in places like New York City to see progress in this area. So I'm going to try to bring it a little closer to home to talk about some work that we're doing to try to monitor changes in food environments over time, and this is actually a 7-year project. So I'm going to talk about Alberta's Nutrition Report Card on food environments for children and youth. So, you've already heard tonight that food environments are extremely important. They shape the availability, the affordability, and the social acceptability of food and nutrition choices. And choices is in air quotes there because, it's not really a simple matter of individual choice. Our choices are indeed structured by systems and by structures. And we do know that there are associations between food environments and diet-related outcomes. And I'll give credit here to a report written by a former PhD student of mine, Leah Miniker, for Health Canada on food environments in Canada. So what we thought we would do, knowing that food environments are extremely important, is to do some benchmarking. So our idea was to develop an annual nutrition report card on food environments to do two things, really. To provide an assessment of how current food environments and the policies that shape those food environments support or create barriers to improving children and youth's dietary behaviors and body weights. These also influence adults dietary behaviors and body weights as well, but very often people are much more inspired by children and youth because they are more vulnerable and perhaps unable to make choices on their own as well as adults. But we also wanted to increase the awareness of public, practitioners, and policymakers on the relevance of food environments for health promotion and obesity prevention. Because there still is an impression that individual choices are what is changing our health status. So I'll give you a little bit of a history of the report card. We started in 2015. We were actually inspired by the physical activity world, what used to be the Healthy Active Kids and now is the Participation Physical Activity Report Card. They have about 10 years on us. We got some funding from Canadian Partnership Against Cancer, or CLASP project, and in 2015 we developed the first Alberta Nutrition Report Card. And this is actually the paper on the development of the report card, written by Dana Olsteds, who's sitting in the front row up here, who was a research associate on the project at the time and is now an assistant professor here at U of C. Basically, we thought this idea of bringing the environments to the forefront is something that physical activity has done really well, and nutrition really needs to have this attention as well. So how did we create it? It started off with a review of literature on food environments in children, and then we also had an expert working group that included over 20 nutrition and physical activity experts. We included physical activity experts because we had expertise from those who were involved in the physical activity report card that helped us to identify what some key indicators would be that we could monitor over time. And so basically, we ended up adapting a framework, the conceptual framework adapted from Brennan, that looked at 5 environments. And altogether, we have 36 indicators within these total 5 environments. So the physical environment is what's available to us. So things like what's available for kids in schools and recreation facilities, in childcare centers, what kind of food is available to them, but also what kind of food is available for kids in restaurants. What do kids' meals, do they have high sodium? Are cereals high sugar? That type of thing. That's the physical environment, what's available. Communication environment, that's what kind of messages are kids hearing. So that could include nutrition education in schools and the curriculum and such, but it could also include marketing, right? What kind of messages are kids receiving through television, on billboards, that kind of thing. The economic environment, how affordable is it for kids and their families to eat a healthy diet? So we have indicators in there around whether or not there is a tax on certain foods. We have indicators on food security status and whether or not that's going up or down. We have indicators on the cost of a healthy food basket and whether that's sufficient. The social environment, sort of the norms and such, includes indicators such as whether or not weight bias is acknowledged and addressed in schools, and whether or not breastfeeding is supported in public places. And the political environment really is that overarching environment that incorporates those 4 others, which includes whether or not we have sufficient funding, whether we have policies in place that actually support these types of environments. So how it works is we have these environments. So for example, in the physical environment, within that there are some categories. So for example, food availability within settings would be one of the categories within the physical environment. Then we have indicators. Indicators are specific domains within each category where actions and policies could be assessed. So things like the high availability of healthy food in a setting. And then we have a benchmark. And basically the benchmark is what would we want if we had a strong policy in place? And we have a benchmark for each indicator. And so an example of a benchmark is that 75% of food offered in schools is healthy according to the Alberta Nutrition Guidelines for Children and Youth. So that's kind of how it works. Grading, we actually have an expert working group that meets annually to grade the data that we collect. And we collect data predominantly from public sources, from research studies that are ongoing that we're aware of in the province. And there's a lot of phone calls made, a lot of gray literature searched as well. But basically what happens is we collect the data, we look at the data. If you meet the benchmark, you get an A. It's that simple. Well, We don't give out a lot of A's, unfortunately. If the benchmark is not met at all, and if there are no policies in place, no systemic programs that are looking to actually help us work towards achieving a benchmark, you get an F. The rest is somewhere in between. So, you may not have completely met the benchmark, but there's policies in place, you're moving forward. So, we give a little bit of, B, C, and D. So let me give you a little bit of highlights from the last 3 years. So in 2015, the overall grade for the province was a C. Not so bad, but if your kid brings home a C on a report card, you want them to do better, right? We could do better. So let me just run through a couple of examples of where that may have come, and that's the overall for all of the 36 indicators. So here's how it worked back in 2015. We had the physical environment, and we were looking at the benchmark of approximately 3/4 of available foods are healthy in schools. This is the data that we collected. We actually had two sources. One was from a national study called COMPASS, which was looking at schools in a couple of provinces. We only had a few schools in Alberta that were included in the COMPASS data, and those were predominantly junior and senior high schools. And if you, see, do I have a pointer? Yes, I do. I can only point to one at a time, though. So on the left part of your screen, you can see that predominantly the red means that those are the foods that did not meet the guidelines. So most of the foods that were identified in the COMPASS study did not meet the guidelines. On the right, we did a survey of principals, and we asked them whether or not they were using the guidelines and whether or not they achieved the guidelines in their schools. And they did a little better, and those were predominantly in elementary schools. So what we ended up doing is we said that the benchmark was somewhat met, and we do have policies and systems in place to try to improve that. So we ended up giving a grade of C. So that's kind of how it works. That's 1 out of 36 indicators. In 2016, we went down. We ended up with a D. And when I reflect on what happened in 2016, what was really interesting is where we went down was in the political environment. And what had happened is that when there was the sort of alarm bells rang in the middle of the 2000s, 2005 and such, about the childhood obesity epidemic, there was a fair amount of funding in Alberta put into addressing childhood obesity, lots of programs and such. Many of those came to an end around 2015, so 10 years later. So many of the programs and policies that were in place from the oh, I'm right on time. Thank you. From the mid 2000s had sunsetted. So that's where we saw the decrease in the grades. But I'll give you a couple of other examples. This is an indicator from the economic environment. Subsidized fruit and vegetable subscription program in schools was our indicator, and the benchmark is that children in elementary schools receive a free or subsidized fruit or vegetable each day. Well, from our principal survey, we realized that only about 21% of our principals indicated that kids receive such a thing, and those were predominantly in impoverished schools or disadvantaged schools. So even though it was only 21%, we did give a somewhat in that there were efforts being made. And there are no policies in place, however. So that that suggested that we should give a D for this. We gave a plus, in that plus would indicate that at-risk groups were being addressed. The other thing that we started doing in 2016 was being more active with our social media. And Ashley Hughes, who you'll hear from tomorrow, was part of this, this initiative. And so, for example, in the physical environment, we sent out tweets with these, graphics and such. Over 75% of schools in Edmonton and Calgary have at least one convenience store or fast food restaurant within 500 meters. So that would have been considered something that was not a healthy food environment. In 2017, we went back up to a C, and there were a number of reasons for that. But it's interesting to see how the overall grades have not changed significantly, although individual indicator grades have changed. Just to give you an example, let's go back to the high availability of healthy food in school settings, which we saw in 2015 had a C. We actually moved it up to a C plus in 2017 because the government of Alberta had initiated a new program, the Children's School Nutrition Program, that addressed healthy meals in predominantly disadvantaged schools. And this really aligns with that data in terms of the indicator in the economic environment on a subsidized fruit and vegetable subscription program in schools. And we went up to a C plus because that Alberta School Nutrition Program reaches 5,000 kids from K to 6. I will give you a little bit of a heads up. For the 2018 report card, this grade's going to go up because we're up over 20,000 kids now. Also, one of the things that we looked at in 2017 was, we've always looked at things like the physical accessibility of restaurants and such. And so traditional convenience stores and fast food outlets not present within 500 meters of schools. We had a D in that environment that was very consistent with the previous year, knowing that 75% of schools in Edmonton and Calgary. But one of the things that we did in 2017 is we decided we would go outside of where the data was easily available. So we worked really closely with the environmental health inspectors with Alberta Health Services, who provided us with their entire list of all food service outlets in the province, and then we had to geocode it and figure out where all those were, and then we had to categorize whether or not we consider that an unhealthy or a healthy food outlet, and then figure out where it fit in relation to schools. This is a slide showing the data from high level, which actually, you would think that in a much smaller jurisdiction, we might have a better chance of having less healthy stuff available, but still 50% of the schools had one of these less healthy food outlets within 500 meters of the school. Another thing that we did in 2017 is that if you go to our website and download the report card, it's about 200 pages, because we have a lot of detail in there about what the research suggests and why we are looking at this, what data we collected, how we came to the conclusion of the grade, and then we have a summary that's about 20 pages. But that's still too much for some people, so we decided to have an infographic which really summarizes some of the key findings and some of the recommendations all on one page. And so we called it a roadmap. The other thing that we did in 2017 was to focus. In 2015 and 16, it was just a general discussion of the food record, of the food environment in the report card grade. And we started to realize that, this could get old for the media. They might just say, oh yeah, here's that report card again, same thing. So we decided to focus. And what we did focus on was youth. And the reason we did is because just before we released the 2017 report card, the results from the Canadian Community Health Survey data, which we had data from 2004 and data from 2015 that had measured height and weight and obesity data for children. And what we noticed in that was that some of the indicators of childhood obesity were actually decreasing amongst the younger ages, but not amongst the youth. And when you think about what some of the policies that were implemented in the mid-2000s, a lot of them were around younger kids. So we thought, let's take a little focus and think about what's happening to kids who are now free to leave the school grounds at lunchtime and go to those 500-meter proximity fast food outlets, or go to the recreation center after school because their parents think it's a healthy place for them to hang out, and yet after they play basketball, the only choices to eat are poutine and pop. So these are the types of things that we start, and they're targeted for marketing on their smartphones. So these are the types of things that we wanted to highlight in the 2017 report card. Just so you know, One A that has been consistently given out is in the political environment, in that we do indeed have a food rating system and dietary guidance for food served to children. They have the Alberta Nutrition Guidelines for Children and Youth have been in place for over a decade now. They're not mandatory, although some school boards have chosen to make them mandatory on their own. We have no data whatsoever about what's going on in childcare centers, although there's some research that's ongoing right now that hopefully will help to inform the 2019 report card. And in recreation facilities, we're really doing abysmally. So these guidelines are in place, and sometimes we think that policy will be our solution. Here's a policy, but implementation is absolutely essential, and you need lots of resources to do that implementation. So we can't forget about it once the policy is made. Interestingly, and it kind of really hit home when we started listening to New York City's story, is that in 2018, we have decided, before we release the report card, that our focus is going to be on municipalities. So although we're collecting data on the entire report card, all 36 indicators, we're going to focus our media releases on what can municipalities do. So things like zoning, about where fast food restaurants go and where supermarkets go and where fruit and vegetable stands go. Recreation facilities continues to be a huge issue for us, with about 75 to 80% of the food and beverages sold there as being less than ideal and considered the choose least often foods in the Alberta Nutrition Guidelines. We certainly can use local policies around things like marketing and what signage are we allowed to put on our buses? Things like that. All of those things are under the jurisdiction of municipals, and then local policymakers certainly have an influence. Oops, skipped over one. So, just to conclude, communication and advocacy with policymakers has piqued interest and engagement. Every year we have sent letters to the Minister of Health, the Minister of Education, Minister of Agriculture, and we have always received responses back and have met on a regular basis about what can be done. We have increasingly refined and targeted our process as we've moved along. We have made some change in individual indicators, although the overall grades have been slow to change. The other thing that we're doing right now in 2018 is engaging local communities. So we've done some mini report cards with some rural communities who think at first that food policy is very abstract and something that happens in the legislature or the parliament. But, when they actually sit down and recognize that, oh, our local supermarket doesn't have any point of purchase nutrition information, they think, I can work with the local dietitian and I can work with the local supermarket owner, and we can actually do something about that in our own community. And that's been very powerful. And just so you know that we are, this is a 7-year study. We have funding to do report cards through to 2021, and we are looking at longitudinally assessing the impact on policymakers' readiness, public interest in changing policy, and children's diets and children's health outcomes. So as I mentioned, our future directions is the local data collection in collaboration with Alberta Health Services, the mini report cards. We are expanding to other provincial jurisdictions. We have interest and collaborations now with Ontario, Nova Scotia, British Columbia, and Manitoba, and Quebec. And so we're certainly looking to expand this to other jurisdictions. And we are part of INFORMAS, which is the International Network of Food and Obesity Non-Communicable Disease Research Monitoring and Actions. INFORMAS. Thank you.